want you to imagine something. Imagine being born into a small metal cage. You've never seen the outside world. Every day, bright lights shine into your eyes. Strangers pick you up, inject you with chemicals, perform procedures on you, and then place you back into the same cage. You don't know why it's happening, and you have no way to escape. This isn't just a sad story, it is the daily reality for millions of laboratory animals around the world. According to the National Institute of Environmental Health Science, scientists are now developing safer alternatives that can reduce the need for animal testing while continuing important medical research. Today, I want to persuade you that reducing animal experimentation and supporting modern alternatives can protect animals while still allowing important medical research to continue. Like many of you, I care about both animals and medical progress. We all want safe medicine, vaccines, and treatment. The good news is that modern science is showing us we don't have to choose between helping people and protecting animals. Today, I'll discuss common myths and facts about animal experimentation. Then, we'll look at research showing the growth of alternative testing methods. Finally, we'll discuss the impact animal experimentation has on laboratory animals. Let's begin by looking at some common misconceptions. Many people believe that animal testing is the only way to develop safe medicines. However, according to the National Institute of Environmental Health Science, researchers now use alternatives such as human cell testing, computer models, and organ-on-a-chip technology. These methods allow scientists to study how human cells react without relying on animals. Another common myth is that animal testing always predicts how a human will respond. In reality, animals and humans have important biological differences. According to Dr. Aisha Akhtar's research published in the Cambridge Quarterly of Health Ethics, many treatments that appear successful in animals later fail in human clinical trials because animal bodies often react differently than human bodies. The third myth is that animal testing cannot be reduced. That is no longer true. According to the Regulatory Affairs Professional Society, the FDA has already begun encouraging researchers to use modern alternatives whenever they are scientifically appropriate. This shows that the scientific community itself recognizes that new methods can reduce dependence on animal testing while maintaining safety. Now that we've separated myths from facts, let's look at what current research tells us. As you can see on this graph, the use of alternative testing methods has steadily increased over the recent years. The graph demonstrates that researchers are investing more in technology like artificial science, organ-on-chip systems, and advanced computer modeling. This trend is happening because these methods often provide information that is more directly relevant to humans than animal models. Instead of relying only on another species, scientists can now study actual human cells and tissues. The FDA's recent efforts to support these technologies show that the future of medical research is changing. Scientific progress no longer depends entirely on animal experimentation. The graph reminds us that reducing animal testing isn't just an idea. It's already becoming a reality through scientific innovation. While statistics explain the issue, they don't show what the animals experience. Now, I'd like you to imagine one more scene. Picture a small beagle puppy. Instead of running through a backyard or playing with a family, it spends its entire life inside a laboratory. Every day, it waits alone in a cage. It may undergo repeated injections, surgeries, or exposure to chemicals. Loud noises, unfamiliar people, and constant confinement become its entire world. Many laboratory animals, including dogs, rabbits, mice, monkeys, and cats, experience chronic stress from repeated handling, isolation, and experimental procedures. Even when researchers follow ethical guidelines, these animals still experience fear, discomfort, and lives without freedom. As science continues to develop better alternatives, many of this suffering can be prevented. Supporting newer technologies doesn't mean stopping medical research. It means improving the way research is done while reducing unnecessary harm. If better methods already exist, continuing to rely on animals whenever alternatives are available becomes harder to justify. Today, we have discussed 3 important ideas. First, we separated myths from facts about animal experimentation. Second, we looked at research showing that alternative testing methods are becoming more common and more effective. And finally, we also learned about the impact animal experimentation has on millions of laboratory animals. Now, I'd like to ask you something else. How many of you would be willing to volunteer with an organization that works to reduce unnecessary animal experimentation? If that's too much to ask, then let me ask something much simpler. How many of you would be willing to choose cruelty-free products and support companies that invest in alternative testing methods instead of animal experimentation? Every purchase we make sends a message. Every voice supporting scientific alternatives encourage a future where medical progress and compassion can exist together. Thank you.